I'm here with Professor Ser Kiat, Group CEO of Singapore Health Service. Hello.
Hi.
What are you addressing this year at the World Health Congress Middle East?
I've been asked to address three fundamental topics. One is on innovation and how that drives better care, better outcomes, more efficiency, and cost effectiveness of care. The second issue which I will be addressing tomorrow will be on the use of electronic medical records in terms of improving care to all our patients, in terms of, again, safety and quality. And finally, the third issue I'm addressing on is trying to find a model of care that is good, that works for the organization.
And why do you think such an event is important?
It is important because we come from different parts of the world. We have different experiences, we have different successes and failures, and coming together we share our experiences, we share our success, we share our failures, so that everybody goes back richer in experience and with a stronger network to talk to each other.
And what are the main challenges that your organization faces in the healthcare industry? What is keeping you up at night?
Okay, very often when people ask me what's keeping me at night, I say too much coffee. But on a more serious note, my organization shares the same fundamental challenges that other healthcare organizations in the world share. One is talent, adequate, talented manpower.
Very common answer.
Yeah, very, very common problem across the world. Today, most healthcare institutions in the world are severely short of doctors, good doctors, nurses, allied healthcare professionals, healthcare managers, healthcare leaders. Right.
What is the solution for this problem?
I think
I always ask about the question, but I never ask about the solution.
Which follows up to the second challenge, which is also part solution, not the entire solution. That is adequate funding. Right. In order for you to bring in the talented people, you must start with what in Singapore we call it a hygiene factor. Give them a decent compensation to bring them in. But that's not the whole answer. Compensation is only part of the answer to bring them in and keep them in. The other part will be that how do I create an environment that is challenges them to stay and solve the problem. I'm talking about creating an intellectual and scientific environment that inspire their aspirations and a passion to stay on. Right. So these are two things. Manpower, talented manpower, financial resources. The third one, which I thought is just as important, is how do I get my existing staff to undergo a fundamental change in mindset to move along what we call the modern healthcare route. Because doing more of the same is not going to help. So these are three fundamental problems that we face in our country.
And many countries.
Yep.
Many countries all over the world. What are some of the innovations your organization brings to the healthcare industry?
Well, as I've spoken at the panel earlier, innovations can take place in three broad areas. One is how do I harness scientific discovery and clinical discovery in the laboratory and the ward to translate that into better patient care, right? That ends up in better outcome and results for the patient. So that's one area. We, in our own small way, have succeeded in a small number of areas. I'll give an example. In Singapore, which you don't see in the UAE here nor in America, we see large numbers of nasopharyngeal cancers. That's cancers at the back of your nose. We see large numbers of liver cancers. These are areas which the US and Europe are probably not interested in doing their research on. My guys have actually found a way to at least improve the outcome of these two groups of patients. Right. The second area which I always emphasize to my chaps is you need not necessarily go up high-tech in science to discover and innovate. We can leverage on existing technology in IT and other technology. I give you an example. We were among the very first to move along the electronic health records and electronic medical records. Today, right across all my institutions, we share for one patient, we share one electronic records. It doesn't matter which hospital or which clinic he goes to. At the click of a button, the provider will have access to all his records. Right. And we are moving very rapidly into using handheld mobile computing devices like your smartphones, your
Something
tablets.
very practical.
Yeah, the tablets, your laptops, where the doctor or nurse can go anywhere and have access to the patient's information and manage the patient accordingly. Similarly, patients who are IT savvy can manage their own condition at home without having to come to the hospital.
Wow.
Right. So this is the third area is what we call innovating our existing processes. One reason why we pay a lot of particular attention to this is, if you look at it, today's processes of delivering care in many hospitals are very archaic, very bureaucratic. There are many things you can do away with without compromising the outcome for these patients. One good example is we are moving very rapidly into introducing to all our hospitals a robotic drug dispensing machines that takes care of about 70% of all the drugs prescribed, thereby freeing the pharmacist and dispensing assistant time to do something else.
That requires
Yeah.
their skills.
Yeah, so these are what we call examples of innovations that helps in improving care.
Fantastic. Continued innovation, as you said, is vital in healthcare and healthcare delivery. What are the main obstacles to innovations do you find around in the developed world?
Well, I think I won't call these obstacles. Sometimes regulatory bodies are very slow to approve things. I mean, rightly so because...
New ideas.
Yeah, new ideas. Rightly so because their primary concern is patient safety, right? And it is for us, healthcare deliverers, healthcare providers, who comes out with this innovation to convince the regulators that they are better and safer than the previous technology. So that's one. Two is, where do I find extra funds to do all this research and innovations? How do I pilot it? Without the funding to pilot it, it's very hard to innovate.
Of course.
Right. And finally, again, mindset. There are some very senior people within our organization who are so fixed to doing things only one way. And these are what we call some of the established leaders that we need to convince them to change their mindset, undergo a paradigm shift in terms of delivering care.
Because that change in mindset in the top
Yeah.
will spread.
It will cascade downwards.
It will change the traditions and cultures
Right.
and improve
Yeah.
the quality of life.
Let me give an example. In the year 2002, we were in the early phase of our introducing our electronic medical records right across the
2002?
Yeah, right across all our hospitals. I got some very resistant senior clinicians who refuses to use it. For instance, using the electronic prescription. I persuade, I cajole, and I try to incentivize them. Nothing happens very much. I had to use a stronger tactics. Came 1st January 2003, I told the senior clinicians, if you don't use the electronic prescription, thou shalt not prescribe. And I mean, I don't have to resort to such strong arm tactics all the time.
But sometimes you need to...
Occasionally, I would say occasionally.
Yeah.
So that's how we went about introducing our electronic medical records.
Fantastic. Professor Ser Kiat, we're looking forward to the rest of your discussions at the World Healthcare Congress Middle East, and thank you for joining us today.
Thank you very much for inviting me. It is a pleasure to talk to you.